Before I start, I would like to thank Imdad's group for giving me the opportunity to be here today, sharing some of my experience for the audience. And I hope this contribution will add something to your practice, and I hope that you will enjoy the talk. Working in medical aesthetic field, I consider it is a very challenging thing, because we are dealing with a highly demand patient that they are always asking for more. Being a part of the practitioner that they are working in this field, we have to be aware about everything that could challenge us during giving the plan to our patient or the treatment for our patient. So usually we are facing certain inconvenient problem while providing the plan. These challenges could be due to the treatment plan itself, or could be due to the technology. And I think dealing with the technology problem is a bit easier, as the manufacturing company have been doing a great job the past few years in developing these technology that we can use in our practice. I cannot forget the first cryo lipolysis machine that I've been using in 2011. It was very inconvenient machine with the therapeutic temperature they are providing, the handpiece. It was really hard to treat different body type parts with this machine. But now, thanks to the technology, everything is evolving, and our result that we are providing to the patient are becoming better. The second thing will be the treatment challenges, which is usually due to the gap between the patient expectation and the result that we can achieve. That's why we need to be very honest with the patient about that. We achieve a result, but this result is not a fast result. It's not immediate result. We are talking about a cumulative result that you cannot compare it to the surgical procedure. We need time. We need adherence to the number of the session and the plan we are putting in order to reach the wanted result that will satisfy the patient. And also, sometimes we have the problem that we delivered a good result, but the patient cannot see this result because they have been seeing themselves on a daily basis, and we are making an improvement, but this improvement gradually. So sometimes they don't realize that there have been a change that's happening to them throughout the treatment plan. That's why measurement is very important, and also taking photos before and during and after the session is important. Just I tell my patient, I'm protecting myself as much as I'm protecting you, because we need to make sure that we are creating changes in your body. And Crystal Pro has now the ultrasound technology, which save a lot of time and hustle in convincing the patient that we really created a result. I remember many years ago, I was treating a patient and we delivered a very good result. She lost more than 20 centimeters in 6 weeks, which is way above the average, but she still was complaining about that. I can't see result. No, the measurement was not accurate. So imagine that we have something like the ultrasound, how much hassle we will be saving by telling her, this is your ultrasound before and this is your ultrasound after. And of course, the patient budget and time can create a huge problem, because they don't have the required budget every time, or they don't have the luxury of coming to the clinic more than once or every week. So all of this could upstrain our capability to deliver a proper result. Next, please. Dealing with Middle Eastern patients, I think it's very challenging, because the patient wants to be perfect, but they don't want to be perfect. Like, they want to look perfect, but with a minimal effort. So they need to have nice bodies, but they don't want to adhere to a healthy lifestyle and exercise program and so on. So we need to educate the patient about the importance of being healthy and following a good lifestyle, a healthy lifestyle. But at the same time, I do not agree with the doctors or the practitioner who's telling the patient, if you're not following a diet, you won't see a result from doing the non-invasive devices. Which questioning the device, the patient will have a question in his mind. Does it really work? If it's working, why he's asking me or she's asking me to do a certain diet and to follow an exercise program? We should explain to the patient that if you are going to follow a healthy regime, diet, and exercise, this might help you to improve the result or to have a better result. And I'll explain later on. It might be, it's not something assurance, but they need to maintain the same weight. So if you have the patient coming to your clinic and he's 70 and he wants to do a program with you, we need to make sure that he's not gaining weight, because in case he's gaining weight or she's gaining weight, there will be upstraining the result. I'm removing part of the fat and he's building the rest. So there will be no benefit from doing the session. So following a diet is not a necessity, but they should maintain the same weight. Rushing the result is a huge problem we are facing with our patients. Like, they are coming every 2 to 3 sessions and complaining that we didn't see a noticeable changes in our body. We need to tell them, to assure them that by the end of at least the 45 days, and I'm talking about 45 days, because if we are performing any procedure that creates cell apoptosis, like the cryotherapy, using injectable materials, using a 1060 laser or the HIFU, all of this is distracting the fat cells. And in order to eliminate this, that's need to wait at least for 45 days. Within the 45 days, we will be seeing an improvement, but it's a gradually improvement. After the 45 days, we will see the final result. All of this should be explained to the patient. Beside that, we are working on body shaping, not weight management. So all the procedure we are doing is aiming to create a better body shape, a better measurement, but not to change the scale. So you're not going to lose any kilos by performing this procedure. And then the next question will come from your patient asking, then where the fat will go. Are you depositioning the fat in my body? And of course, we're not doing this because we are talking about tissue. We cannot remove a tissue from one side to another without a surgical procedure. All what we're doing, we're either shrinking the tissue or distracting part of the cell, and later on the body will eliminate these cells. Then why it's not affecting my weight? Because simply what I tell my patient, if I get a needle right now and I set like 5 to 10 ml from your abdominal area, would it make a difference? She would say, yes, like 10 centimeter, 10 cc or something. She would say, yes, it will go inside. I said, if I get this needle and I put it on the weighing scale, do you think that the scale can detect it? And sometimes if I have a bottle of water or something, I put it on the scale and they would see that the scale is not changing. So the fat is very light, to the point that the body cannot detect, or the scale cannot detect the minimal millimeter we are getting rid of the body. So again, we are creating a better body shape, but we're not changing the weight. Dr. Farid, do you have a contribution on this? How it's different from what you're facing in your practice?
Well, I think we have a lot of similarities as you have, but I think maybe in Arabic countries, people are more discussing that kind of topics, but we certainly have it here in Europe as well. And what I usually tell them about the weight issue is that, like, if you look at 100 grams of fat tissue, that has a huge volume. So the volume is big, but it weighs 100 grams. When we're talking about muscle, the volume is very, very little, which is 100 grams. So I tell them, when you decrease that volume, so you will notice it in centimeters because the volume is decreasing, you are removing fat cells. Still, you will not see it on the weight scale, because if it's only 100 grams, you will not notice that different, but you will notice at least 2 to 4, sometimes 6 centimeters after one session. And that can mean that your clothes will be fitting better, or even maybe you are one size smaller than what you used to be, which is a very nice aspect, but you will not see it on the weight scale. So if you want to lose weight, we have a different program where we change your mindset. I do not believe in diets as you do. You have the same. You don't believe in dieting. I think the machine works by itself. So it's a good technology that will work. So two main things. Even if someone is overweight but is happy with his overweight, that is fine. We can contour them with a very strict notice that we are not decreasing their weight. They will stay the same. But the only thing that I ask them to be is that to be consistent in that weight. So if someone is 10 kilograms overweight, that's fine. We can treat them and shape their body as long as they are the same with that 10 kilogram overweight. They cannot increase. So we weigh our patients from the beginning and in between every session, because if there is a more than 2 or 3 kilogram increase, we will tell them you are actually sabotaging the treatment. So don't do that.
Exactly. Thank you, doctor. Moving to the body treatment plan we are creating or program. And so many times we have a patient that's coming upon the recommendation or of her friend, telling me, could you please do the same procedure you did to my friend because she's been having a great result. And usually I explain to the patient that we are tailoring or creating the plan according to the patient need, the body type, the problem we are facing. So what I do with my patient when they first come, I put them on the mirror and I ask them, what do you see? What is the most thing that bothers you in your body wearing your clothes and without your clothes? And then we start to prioritize. Do you care more about the look while you're having your clothes on, or you're caring more about the look without your clothes? So sometimes they care more about the skin texture, the cellulite they are having, more than the fat deposition in a certain area. So we need to know what's the patient priority and the need. Sometimes we need to direct them because they are focusing on something and they want to treat this area first. But from my point of view, I say that no, we need to treat that part of the body first, or what you want, it's not suitable. It will create a wrong definition of the body shape. So we discuss this until we reach to the final conclusion, which body area we want to start with, and then we create the plan according to. By creating the plan, what I do in my practice, I don't believe in one technology. So I always like to attack the problem with a different body, with a different machine, with the different technologies in order to achieve the best result. So I explain to the patient that I'm going to use this technology in this order. You need to come to the clinic maybe once a week with an interval, twice a week with that interval time, depend on the case. And then we talk about the expected result that we're going to get within the 45 days, how many centimeters we're expecting to lose, taking the measurement and discussing the budget. Everything should happen in the first consultation before we start the plan. We are dealing with different type of patient, different need, and different categories of the patient. So we have a 4 category of the patient we are dealing with. First could be the patient who's undergoing a weight loss surgery. We're talking about the bariatric surgery. Being a dietitian, having the privilege of seeing those patients from day one. So I always educate them about the importance of tracking the body changes, especially in the skin. Because sometimes you see the patient come after losing 50 to 70 kg of body weight and then asking you to fix the skin non-surgically. In this case, I'll tell the patient, I'm sorry, I cannot, because we need to cut off this extra skin. But seeing the patient from the beginning, educating them about that there might be a changes happening to your skin every 10 to 15 kilo. We need to perform certain procedure that will help you to tighten up the skin, is adding to the result we can achieve, because we don't want to start very late. And then dealing with the patient with the excess weight. And in this case, we have 3 type of patient that we could deal with. First one, as I mentioned before, the patient with a fat deposition in only one area of the body. And in this case, if I have a woman with an apple shape, I know as a dietitian that if I'm going to do a diet for this woman, most probably she will start losing weight from her lower body before the upper body. So in this case, I don't recommend the diet plan. I recommend starting with the machine, trying to create a bit of a balance between the fat distribution up and low, and then continue with the diet. On the other case, I might have a patient with a nice body distribution, but she's overweight. So most of the time, I'll start in this case with the weight loss plan, and then the stubborn area, I'll work on it with the machines. Or we could face the patient who hit the plateau. They've been doing a diet for a long time, and then suddenly the weight is not moving anymore. So in this case, I would recommend using the non-invasive body contouring machine in order to give them a push a little bit. They will feel that the body is changing, and then we could continue again with the diet or walking parallel with the diet and the machine. Dealing with a slim patient, these are a bit of, I call them the fancy patient. So they are looking good, they are they have a nice body, but sometimes they have a bit of a stubborn fat that interfere with their capability to see the muscles as shredded as they want. So in this case, we can work on that fat, removing the part of the fat in order for the muscles to look more defined. Or in other cases, they want to augment the muscle mass, and thanks to the technology, we can do all of this non-surgically. And finally, the patient who does not want to go under knife. But with these patients, we need to be very careful, very honest, not taking any case with a high expectation, because in many cases, they want to compare the result they are taking non-invasively with the surgical procedure. So we need to tell them that we will have less, in many cases, less results compared to the surgical ones. Dr. Farid, would you like to add something?
So yeah, I think the consultation of these patients is very, very important. But what we see mainly is a category of people who mainly do not want to have any invasive. So from the 4 categories, I think what we see most is the people who don't want invasive procedures to shape their body. And in our consultation, we focus on the 360 assessment of patients. So we stand as you do also in front of the mirror and ask them what they don't like. But I like to point out also the areas that even if they did not mention, because it has to do with the total body shape, I would mention it. They don't have to do it, but I would mention it so that they understand more clearly how the whole body looks like. So if you would only treat, for instance, an abdomen, and there is also some excess on the flanks will stand out. You know that, because when the abdomen becomes slimmer, the flanks will stand out. And I will tell them that. So in most cases, they will agree with me that when we do abdomen, we will do flanks as well. So we will do the whole area. And that makes more sense than just going and focusing on 1 or 2 areas.
Right. Thank you. Moving back to the patient consultation. So as I mentioned before, we need to address the patient need and set a priority, creating a 360 plan by explaining to the patient what we are going to do, and ask them to adhere to our diet, to have a healthy lifestyle in order not to gain weight during the treatment plan, and also talk about the technologies that we are going to use, and explaining to the patient why we are having more than one technology, what's the importance of this, and putting the time frame for the treatment plan, and telling them about the expected result. Some practitioner could treat more than one area at the same time. But for me, I prefer to focus on 1 or 2 areas. Like I would work on the abdomen and flanks at the same time, but I would never work on the abdomen and the thigh at the same time. And this is for 2 reasons. First, when you work on the 2 areas at the same time, because both are changing, so the patient may not notice the massive changes that's happening in one area because the other area is changing a lot. And at the same time, we have a problem in the Middle East. The Western patient, they don't have it. When I was practicing in London, I did not see this problem. But here in Saudi Arabia, we have a problem in draining the fat out of the body. So if I performed a certain procedure and I did not follow up with other procedure that will help to drain the fat out of the body, I would see that the result is very minimal. And this is because we have a problem in lymphatic drainage. It could be, we don't have, honestly, a scientific result why the Middle Eastern people have this problem compared to the Western patient. That's why when we overload the body, like liquefying a lot of fat at the same time, different area, so many parts of the body, we see that the body loses its capability to drain this fat out. So the result will be way less compared than focusing on one or two area near to each other, um, instead of treating a big part at the same time. Of course, discussing all of these possibilities with the patient, and finally taking the measurement, giving them the consent form, and taking the photographs, not just before the session, before, during, and after, just to make sure that we are walking on the right track, because there is a lot of things that could happen and upstrain the result we want to achieve. Can we go next, please? Okay, talking about upstrain and things that could ruin our result, there are many factors that can come up during our treatment plan, and first could be the patient budget. I remember recently I had one patient, she wanted to treat the arm area, and I addressed the case and I put the plan, and she was complaining that this is above her budget. And she was pushing to do less procedures, and she thought that she might achieve a good result. And unfortunately, I obeyed to her demand, and we did the procedure not according to my original plan, and the result were very minimal. And because I don't like to let patient go without a satisfactory result, so I started to compensate her with a free session, which is extra burden on my practice. So I think that we should always stick to our original plan, and to make sure not to undertreat the area, especially if we are using something like the HIFU, that we need to obtain certain number of shots. So sometimes you may reduce the shots in order to reduce the budget for, or the cost for the patient, and it will affect. Same happen with the injectable material. If you need to inject certain amount of vials per session, and then you reduce it for the budget, all of this could affect the result we are providing to our patient. Also, if the patient is not sticking to the plan we are putting, like you tell them that you need to do 5 sessions once a week, and they come every 2 to 3 weeks, of course that will affect the result. Or instead of doing the 5 sessions, they do only 2 or 3. And all of this should be part of the educational plan about the importance of sticking to the exact plan we are providing since day one in order to achieve a good result. Next. Okay. Plan of structure could follow this order: slimming, sculpting, toning, lifting, and it could be a combination of 2 or 3 of them at the same time. So we might need to start with slimming first, and then putting the patient into the toning and lifting procedure. And sometimes you need to do slimming and lifting at the same time. Sometimes you need to do sculpting, toning, and thanks to the new technology, that again we can provide all of this non-invasively and with the minimal effort. Dr. Farid, can you please explain to us more about the structure of the plan you've been putting for your patient?
Yeah, so basically we developed the SensiSlim program 4 years ago because we've seen a group of people who come in and actually want to lose weight as well. So they want to lose weight between 10 to 15 kilograms, and they are struggling to do so. And in the beginning, we would send them away to consult with a dietitian or a sport instructor, whatever, just to change their eating habit and to lose the weight, and then come back for the sculpting. But a lot of people we wouldn't see back because they would be ashamed because they just did not make it. through that whole plan. So we decided we're going to do it in our own clinic. So we started the SensiSlim program with very, very good results, and people really love it. Is that so during 6 months, we first start with step one, which is the mindset change. So it's not dieting, it's changing eating habits. And we use different modalities that can be the swallowable intragastric balloon, it can be the GLP-1 agonists like Wegovy or Saxenda or Ozempic. So, and recently, actually, it is mainly the GLP-1 agonists, and we are not using the balloon anymore because we can achieve very, very good results to 22% of their body weight using the GLP-1 agonists. So that is what we do as a first step. And then when that is done and they are stable in their new acquired mindset and acquired eating habits, we go on with the Crystal Pro and do all the shaping that we need to do. And then we do toning and lifting at the same time as a third step. So we combine the third and fourth step in one. So doing 1, 2, 3. So changing mindset, shaping, and then toning and lifting. And that works very, very well. And that is the SensiSlim program, basically.
Amazing, thank you. Okay, moving to the patient education, as I've been mentioning since the early slide of the presentation, that educating the people about every single step that we are doing is very important to make sure that we are walking on the same line. We don't have a patient with a high expectation, or we don't have patient that does not understand why what we are doing what we are doing. So communication between the practitioner and the patient, explaining every single step is very important. And again, explaining to them that what we are achieving is a cumulative result, not an immediate result. So they shouldn't expect to see a massive changes from the first session, but again, they should see a mild changes happening every week throughout the weeks. All of this will help them not to be frustrated about the sessions, not to think that they are wasting their time and money coming and going and back to the clinic. Having a visual measurement and manual measurement using the ultrasound, all of this will increase the patient satisfaction because they could exactly see that something is happening to them. Again, I remember one of my patients, we were performing some procedure for treating cellulite, and before the end of the treatment plan, I was sitting with her and asking her about her satisfaction rate, and she said that I can't see any changes happening in my body. I said, nothing? She said, not at all. Not the cellulite, not the skin texture. And I said, okay, let's see the picture together. And I swear to God, the moment she saw her first picture, she was like, no way, this is not me. So again, coming back to the point that the patient are seeing themselves every day. That's why they don't notice the changing that's happening in their body. And that's why we need to protect ourselves and our practice by taking an accurate and quantitative measurement that will help us to prove to the patient that we've been doing an exactly something and we are creating changes in your body. And then finally, the home care is also a crucial part. If you remember that I mentioned earlier of the presentation that sometimes we are facing like nodules that happen after using the cryotherapy, and these nodules is just the fat cells, the dead cells accumulating together inside the body. So if the patient are performing a manual massage for the area 10 to 15 minutes daily, this will help to eliminate the fat and break the fat into a smaller compartment that will be easier for the body to get rid of. So manual massage daily for any procedure we are doing for the treated area is important, and also drinking a lot of water is helping in eliminating the fat, especially in our area, as I mentioned, that the patient have a problem with lymphatic drainage in general. Here I'll leave you with Dr. Farid to tell us more about the Crystal Pro and its technology. the mic with you, Doctor.
Thank you very much, Shama. I think it's a fantastic presentation, and I'm really honored to be here with you and having this excellent webinar organized by IMDAD and of course the Leo. So thank you for having this opportunity. So when we're talking about mechanism of cryolipolysis, I think the main mechanism is basically a cooling induced crystallization of fat cells, which ends up by having the fat cells dying basically gradually and being removed by phagocytosis and macrophages, broken down to triglycerides and fatty acids. So there is also an ischemic mechanism because of the suction that is applied, and there is an endocrine mechanism which we don't really fully understand, so I'm not going to go on this. I think what people should understand is that fat cells cannot withstand a longer duration of cooling, and when that happens, you get the crystallization, which ends up in actually the crystallization will end up in breaking down of the fat cells into triglycerides and fatty acids. So can I have the next slide, please? So what makes a machine work? What you need is controlled cooling. What you need is controlled cooling, and you need controlled suction. And with the Crystal Pro, you got both of this. And it is done very, very well. And what I'm really amazed about is actually the controlled suction, because there are other machines that also have controlled cooling, and I've been using them. But if I compare Crystal Pro to the other machine, I'm not going to mention names, but the controlled suction, I think that is really, really superb, because then you do not get pop-offs. It is dynamically controlled throughout the whole cycle. And again, it is also user controlled as well. Can I see next slide? So the suction, you can adjust accordingly which area you are taking. So usually when we do the submental area, we are in a lower suction. We don't want a lot of suction there because we've done that in the beginning and we got a lot of bruising. But when you lower that, you don't get that kind of bruising, but you get still a very, very good result and a very good crystallization of the fat. Next slide, please. Another feature that the machine has is using ultrasound to measure the subcutaneous tissue layer. We can debate about this. I think it's a very nice thing to have. In practice, I would say it doesn't work all the time because, as you know, it is not evenly distributed. So you need to measure a few measurements and then take the mean of the 3 or 4 measurements that you do, because there's not one consistent measurement. But I think it's a very, very added value in the whole range of the machine. Next slide, please. We have a lot of applicators to address many, many, many different body areas, which makes it a versatile machine that you can use. And we use a lot, like 4 areas at the same time, which really enhances the treatment time, because at the bottom line of any machine, it is for the patient. It has to be easy and comfortable. It has to have consistent result, but most importantly, it's all about time. So if you get good results in a short time, that's what people want. And that is when you use 4 applicators at the same time with one machine. I think that is brilliant, which means that you can do like 8 cycles to 10 cycles within 1.5 hours easy. And it is very well tolerated, and people really like doing that in a short time, so that they don't have to come back and forth, especially if they have to drive for a while. Next slide, please. So I think that when doing and looking at what is best practice, I think one of the most important things is doing a thorough 360 examination, where you're also looking for herniation or any defects. And of course, these are the areas that you want to avoid. You'll have to point that out to the patient so that they understand that. The second thing is, I think the massaging is very, very crucial, because there have been many, many studies that to show a better results with 20-25% more results if you do post-treatment massages compared to not doing any massage. So that is something, and also we tell our patients to keep on doing that for at least 3 to 4 weeks after the treatments, which has two main things. Actually, it works as lymphatic drainage, but also it keeps them involved in the whole process so that they are really thinking about how the whole treatment plan is going. And I would like to ask you, Dr. Shema, what about your best practices?
Recently, combining cryolipolysis with injectable material have been many studies saying that it's improving the result, and I've been recently trying this in my practice. So sometimes I tend to use an injectable material at the same day before doing the cryotherapy, especially with the patient with a hard fat. So if they have not the fat is usually easy to deal with, but the hard fat is a bit harder. So using the injectable material and then the cryotherapy, and then combining this with a weekly session of radiofrequency, this helps a lot in having a better result comparing to doing the cryolipolysis alone. So that usually what I do with my patient within the 45 days of expected time frame.
Okay, so you let the patient come after 45 days?
No,
sorry.
but 5 days they come every week to do either a radiofrequency session or lymphatic drainage session in order to drain the fat that we've been working on. Or if the patient has already skin laxity, I would always be worried to remove the fat, and then the skin will be not in a good condition. Yeah, lax. So I make sure to tighten up the skin before removing the full layer of the fat.
Okay, thank you. And I think one of the most important thing in best practices is really, I cannot emphasize that you have to have a very good photographic setup. You need good pictures before with a good lighting, the same distance, so that you can compare. I think if you don't have that, you are in big trouble. You will have discussions after that, because people, as my colleague has already mentioned, tend to forget. They tend to forget. They don't have any idea how they were, and you need to show them the before and after picture. Can I have the next slide, please? So there are a lot of literatures that been published, and all actually this literature we're watching now, that is, which prove that there is at least 25% decrease after each session. Actually, we see even some results with 40 to 50% after one session, which is really amazing, and almost no side effects, severe or non-severe. So I think it's a very safe device, and that it gives really consistent results. Can I see the next slide, please? In this, you can see that this paper showed that at least there is a 90% patient satisfaction. In our clinic, we also tell people that we have at least 92 to 94% satisfaction rate. That gives me also the chance to tell them that there is no machine ever in the market that is 100%. Nothing is 100%, because we cannot. There are different people, different results. So it's not about the machine, it's also about the people themselves. So I tell them that there is always an 8% group that will not respond as the best as we would expect it. And they have to understand that. And that we will do whatever we can do to accommodate whatever we can. But there is a chance that there is someone within that group. But it's a small, very small group. Even in that 8%, there are also what we call non-responders, and we all seen them in our practices. And a non-responder is really bad to handle, but when they know that there is a chance that they can be a non-responder in the initial consultation, people, although they don't like it and we don't like it, they will understand at the end. And we always try to do some kind of compensation so that the hurt will be less. Next slide. So now we are actually showing you some the before and after results. This is the submental area. It was treated twice, and as you can see, very nice shape and very nice contracture of the skin, which is a side thing. where you get a better jaw line and jaw contouring. Next slide, please. I always like when we do 3D pictures with the Vectra XT with oral patients. It allows us to measure as well. But in this case, I like this picture because you can see contouring very, very well with this model. Next one. Here, as you see, flanks, and this as a story because we've been treating this gentleman before with another cryolipolysis machine with very poor results, and actually we had a few thermal events that the machine would register, but there will be nothing to see. And so we had to send them a few times home. And when we got our Crystal Pro, we said, well, this will be a very good candidate to try out. And it was amazing how good the results were. This was only after 2 sessions, and you see a real decrease of the volume of the fat and a better contouring. And can I see the next slide, please? Here you can really see how bulky and how firm this fat was and how nicely shaped now, even after 2 sessions. And we use the Topaz applicator for that, which I really love because it's very versatile. You can use it in a lot of body areas. Dr. Sherman, what do you think? Do you use the Topaz?
Yeah, it's amazing actually. But I have a question. Do you usually do any intervention between the sessions, or
no, no interventions?
No,
I believe no, because I believe that when you have a machine that is supposed to do what it's supposed to do, I don't need to do any interventions in between, because then I'm having 2 problems with this. I'm giving a signal that the machine is not enough, that I need to do some extra things in between. And for me, it doesn't give me a clear picture. Is it working because I've done the intervention, or is it working because the Crystal Pro had done what it's supposed to be doing? So I tend to finish my whole treatment plan, because that is, I stick to my plan. So I've done a plan, I stick to the plan, and I want the patient to stick to the plan as well. And then at the end, yes, we do combinations, but the combination will be after, will not be in between.
Amazing.
That's how we do it. Yeah. Next slide, please. So here the upper arm, and also very, very good results we see. So usually we tell people that if we decrease the fat, it will be because we are, Crystal Pro is not for skin laxity. Here we have some fat, excess fat, and we have skin laxity. And because we are removing the bulk of the fat, there is less pressure on the lax skin, and it will retract for a bit, and that will give a very excellent aesthetic result without having any irregularities or anything like that. And if the people need more tightening of the skin, then we use other modality, as I said, and then you can use radiofrequency, for instance, to improve the texture and the skin quality. Next slide. You can see exactly here how the contouring has improved with only 1 session in this case. Most of the times, the arms would take 1 session and sometimes 2 sessions. Next. This is the other side. Again, you can see improvement of the contouring and the retraction of the skin, which is really nice to see. Next. This is a result from different colleagues where you can see also very nice shaping, where they've done multiple areas at the same time with multiple applicators, and you see how nice the contouring of the abdomen and of the area underneath the bra, and also the flanks. Next. Again, here another very nice result of the upper and lower abdomen done with the 2 applicators, and because the area is remote from each other, you can do both at the same time. Next. Here's a very nice results of the flanks. And there's one thing I want to point out. If you are new to this body contouring, non-invasive body contouring, I would suggest to always start with abdomen and flanks until you get the feel of it before going into other areas which are a bit more challenging than doing abdomen and flanks. And if you look at the overall, I think 80% of patients who come to practices to once more shaping, they are all about abdomen and flanks. Next. Submental area, very nice results as well. Really nicely treated, even after one treatment, as you see, very nice contouring, a very nice jawline visible after 2 months. Next. Gynecomastia, I think, is a very good area. These are the 3 main areas actually for male patients. So mainly it's abdomen, flanks, and gynecomastia. And this is a very, very good result. One thing to consider is that you always have to palpate the gland and also mention to the patient what is gland and what is fat, because what we will be treating is the fatty tissue. The gland tissue we cannot remove. That has to be, if you need to do that, we'll have to remove that surgically. Next. A very nice result as well of the arms, done after one treatment with 3 months follow-up. Next. The bra area, very nice result as well, and a very challenging area, because even with the good dieting and exercising, is very difficult to get rid of. Again, another bra area which is very well treated after one treatment, and you see the before and after 2 months. So we are now at the next part about integrating the treatments in the aesthetic practice. Let's go. Next. And maybe I can give you that back, my colleague Chaima, what you can take it from here.
Thank you, Doctor. So speaking about the importance of incorporating body contouring departments in the dermatology or the aesthetic clinics in general, I think that we have a great potential to target a lot of patients who does not want to go under knife, and plus the other 3 categories we've been talking about. So it's really important to have this as a part of every aesthetic clinics, because first of all, we've been serving the same holistic approach of anti-aging, because we cannot keep educating the patient about the importance of taking care of their face and neck and leaving their body to the aging process. So we could protect the body from aging as well by having a different technology that can work on the skin and the fat and stretch marks, cellulite, especially that in so many cases we already have these technologies in the clinic. Like many of the machine we are using now, the manufacturing company make sure that the machine could work on the face and the body at the same time. So why not having the department and educating the client and the practitioner themselves about the importance of having this procedure as a part of the integral system of the new anti-aging approach. And as we mentioned before, we are talking about body education and how to prevent aging, and that we are creating a better body contouring and not working on the weight loss and so on. And also, my people may not agree with me that we are not targeting the younger generation, but from my practice, what I've been seeing recently, that even younger generation, they are more aware now about the importance of taking care of their bodies and performing certain procedure if they cannot achieve this with diet and exercise. Next, please. Creating the department could be a bit a challenging thing, because at the same time we want to achieve many things. We need to make sure that we will be able to deliver a good result to the patient. We would be able to make money to the clinic, so the operation cost of the machine itself is not high, because if the operation cost is high, then the treatment plan will cost the patient a lot, and then we will come back to the thing that might ruin our result because the patient won't be able to sustain the coming and do the treatment plan. So all of this need to be taken in consideration while we are choosing the technologies that we will be working in our clinic. Also, we need to make sure that the machine is easy to use, because if we are looking back at many years back, the technology we were using were relying a lot on the technician that's using the machine. So if the technician is not good, the result is not going to be good. But nowadays, most of the machine we are using are not relying that much on the quality of the labor or the technician who's using the machine. And also we need to be able to treat different area of the body with the same machine, and we need to make sure that the machine is safe and not creating any adverse reaction with the patient. Next, please. Dr. Farid, can you please share your experience with us, telling us about how we can establish non-invasive body contouring department in the clinics, please?
Yes, absolutely. I think one of the most important things is assessing. So assessment, the right assessment and the right patient selection. And that is something that I treat my team. I train my team to do. And I'm always there to supervise and to see if that is done correctly. And what we usually do is once every 2 months, I would do a whole training session where we use models to come in and we'll do their treatments. And I'll show them how we do the assessment. Usually all assessments are done by myself together with the team, so that I'm sure that we're doing the right starting point. Then we train the team every 2 months to keep them sharp, because any team would go into what I call the comfort zone. When you go into comfort zone, you've been doing it over and over and over again, you tend to just do it and just place an applicator somewhere and just hope that it will get you the good result. It will get you good result because the machine works, but it's not the best result. And I want to have the best result. And if you want to do this, you will have to really look at each patient, because everybody and every single person is different. So it needs really good eye to see where you're going to place your applicator to get optimum effect. So that is very, very important. Yes, the machine works. Yes, the machine is easy to use, but still there is a human factor to get excellent result. You need training, and the training has to be trained and trained and trained all over again. That's one. Second is that you have to have the right selection. And I mentioned before, if you're starting, keep it simple, abdomen and flanks, get used to it, and then go into other areas. Don't make it too complicated, because then you're not getting the excellent result. You want to have excellent results so that people talk about it. When they talk about it, they will send you more people. So that is the second thing. And the third, never overpromise. Underpromise, overdeliver. That's it. It's as easy as that. That is what I would like to share.
Dr. Farid, can you go through the take-home message?
Okay. So the take-home message, I think most important is taking a good photography. Otherwise, you can do an excellent job and still the patient do not see it. You have to have good photography. That is really important. Second, I think do not go for like an area, go for a whole treatment plan. I think that is essential, because we are trained as physicians to see if there is slight changes here or there. People cannot see that, do not want to see that. And when they are spending a lot of money, they want to see real results. So that is second. Third, I think that when doing a treatment plan, I would go, I mean, I've been doing per cycle for so many years. But what I found out is that people want, I mean, although you can tell them, okay, we are not getting you after doing a whole treatment of all the areas, one session, and you come after 8 weeks for another assessment, it is not the end result. We will see results, but it is not the end results. But they don't get this. I mean, I can repeat myself all the time. They do not get it, because they somehow in their subconscious mind, they are hoping that it will only take one session so that we don't have to pay you again. So I took that problem out. I will tell them, okay, we have packages, we have 4 packages, depending on what areas we need to treat. I tell them which package is best for them. It's a one-time only investment, and we will get them the end result. So it is, you do an assessment to not a treatment to transformation. No, you're doing a treatment to end result, which makes it easy because they know if even they have to come 4, 5, 6, or 7 times, you are taking care of them. They don't have to pay you anytime. You don't have that discussion until you get the end result. So I think that is also one thing that I want to give it to people, that don't treat areas, don't treat per session, do a whole treatment plan. And yes, some people will say, well, that's too much for me, I'm not going to do it. You're better off without them than having them and then having a discussion every single time, which will end eventually that after the second session, they will not come back. And then what? Then you have 2 frustrations. One, the client is frustrated because they've spent money and they did not get the end result they wanted. And you're frustrated because you did not get the chance to show them that you can achieve the end result, but they didn't give you that chance. So get out of that area. Never undertreat. I think undertreatment will kill the business. So again, do whatever necessary. If you do not understand that, it's not the right client. That is patient selection. That's all for this. Thank you.
Thank you, Doctor.
Thank you so much, Dr. Farid and Dr. Shema, for this insightful presentation. Your expertise and dedication to advancing the field of non-invasive body contouring are truly inspiring. I would also like to acknowledge the forward-thinking points you have mentioned during the webinar, from dealing with inconsistent results and designing personalized program for each patient need, and how to make these insights feasible in our practice. And lastly, introducing Crystal Pro, which has helped you to achieve those optimum results for your patient. Now, we will move on to the Q&A session. We have received several questions from our audience during the webinar, and I will be sharing these questions with our esteemed experts. If any of the attendees would like to direct new question to our experts, please use the Q&A buttons. So our first question of tonight would be directed to Dr. Shema. Dr. Shema, you mentioned that the difference in lymphatic drainage between Arab and European people and its effect on treatment results. How significant is the impact, and what can patients do to improve their lymphatic drainage?
Hello.
Hi, Dr. Shema.
Thanks for the question. To be honest, if we're not focusing on the lymphatic drainage, the result could be very minimal dealing with the Middle Eastern patient. So usually what I suggest post any treatment that cause cell apoptosis, which the drainage process will take around at least 45 days, that we need to do either manual lymphatic drainage, or we can use the machine, like if we're using a radiofrequency machine post-treatment, if we're talking about the cryolipolysis. So even if we're using a radiofrequency machine, we make sure that the practitioner or the nurse, the technician that using the machine is following the lymphatic drainage passes. So if we're working on the thigh, we need to make sure that we're moving from down to up in order to drain the fat, which will enhance the drainage of the dead cells that was killed by the cryotherapy or any other technology. And also we would advise the patient to do a manual massage daily for 10 to 15 minutes to enhance the drainage, and drinking a lot of water can also help.
Great, Dr. Shema. Thank you so much. Our second question directed to Dr. Farid. You have mentioned that the treated result, you treat to the result program. How can you convince patients to adopt this protocol?
It's a very good question. And that's, as I said before, not everybody is the right candidate for that. So people who are committed are the people who are really serious about the treatment, and they have to understand that it is a several session treatment. So if they are going to get the results they want, we can do that, we can achieve that. We show them before after pictures, of course, of what we have done. But what I found out is people who are really serious about it, they will go for the program. And actually it gives them some kind of relief that they know, okay, we are spending that amount, but we can go on and the doctor will treat us until we achieve the best result possible for the whole plan. So it doesn't really take a lot of convincing, but you have to get the right patient.
Great. Our third question is directed to Dr. Shema. You have mentioned that every 10 kilos of weight reduction typically requires a skin tightening procedure. Is this a general rule, and how should it be implemented?
Actually, it's not a general rule because it depends on the ethnicity of the patient, because some people have thicker skin compared to the other people, and age differences, smoking, healthy lifestyle, all has an impact of the quality of the skin and whether a patient lost weight before or this is the first time. So what we're doing, I call it a skin test. So usually I advise the patient to check the area they want to make sure whether it's started to have a skin laxity or not, and just passing the finger. If we see like a small wrinkles start to appear, it's considered to be the first degree of the losing the collagen, and then it requires a treatment, and that treatment could only be 1 or 2 sessions with the treating with the radio frequency. But if we reach the phase that the skin is doing like lines, a full line, it might need more than 1 or 2 sessions to treat the area.
Great, thank you so much, Doctor. Our next question is directed to Dr. Farid. You talked about the suction in Crystal Pro. How is it different from other cryolipolysis devices, and does it affect the level of pain?
Again, a very good question. All other machines that I've seen, the suction is not, you cannot change by yourself. So the suction is there, is a permanent suction. What you get with that is that in some instances you can get a pop-off, which the machine will detach, or it will give you a pop-off because it notices that there is a decrease somehow in the suction pressure, and it will give you a pop-off. And we've seen that many times. With the Crystal Pro, it's totally different because first of all, you can adjust the level of suction. If you think you need more suction, you can do that. And the other thing is that when you put it at a certain suction level, the machine will dynamically adjust that during the whole cycle. So during the 30 minutes or whatever, depending on how cold you're setting it, it will adjust during the whole cycle, which will actually dynamically be there and will not cause any pop-offs, which is really amazing. And I think that's a very good thing that they've developed at DeLeo. The other part about the pain, yes, when you have a lot of suction, you can get some discomfort. I wouldn't call it pain, but you will get some discomfort. And in some cases, you can get some bruising. And we've experienced that, especially on the submental area, where we did the suction was too high because we were afraid that it will fall off because the applicator is a bit heavy, so it can tend to pop off. But by positioning the patient in the right position, we don't get that the weight of the applicator will pull down on the skin, and we don't need that high of a suction. So yeah, we adjusted that, but that can be like some kind of discomfort if you have the suction too high.
Great, Dr. Farid. Our next question is directed to Dr. Shaima. Do you recommend doing Crystal Pro for double chin over other options?
That's a tricky question. We'll go back on this, depend on the quality of the skin. If the patient have a good skin, we can use the cryolipolysis for treating the double chin area. But honestly, if the patient has a thin skin, I wouldn't recommend using cryolipolysis. I would recommend other technology better.
Noted. Thank you so much, Dr. Shaima. Dr. Farid, does treating pore areas in the same session increase the pain in the session?
No, absolutely not. It does not. But there are, of course, I mean, pain is a difficult thing because that depends on the person who's being treated. Some people are more sensitive than others, but in general, the fact that doing 4 areas, and actually we do like an average of 8 to 10 areas in one session. So one treatment session, but of course 4 in 2 sessions, but it's a one treatment day. So the pain is not an issue. There are some things like when doing male breasts, that is a sensitive area. So especially when the applicator is removed and there is a hyperemia because a lot of blood rushes in there to warm the tissues, that can be sensitive, and it takes about 10 minutes before that becomes more stable.
Thank you, Dr. Farid. I have another question for you. What is the thickness of fat you would consider to do a session on arms, chin, or gynecomastia?
I don't think that the thickness is an issue. Again, I think as long as there's fat, you can treat it, and you can treat it over and over and over again. So there is no like a limitation in thickness of fat. The limitation could be time, could be the extensiveness of the sessions, and probably price and commitment for someone to come. So what we like to do is, like in the first treatment day that somebody comes in, we would like to do as many sessions as possible in that day so that it will save them the time of coming back and forth. So if you can do 10 or 12 cycles in one day, and you can do that because you can do 4 placements in 30 minutes. So if you're doing 10 placements, that will be like 1.5 hours at the most, which is very short time. But at least you are initiating the treatment plan and getting people really committed to that plan. So again, thickness shouldn't be an issue.
Noted, doctor. We have another question to Dr. Shaima. How can you use the machine for rigid and firm areas like thighs?
You mean in which part of the thighs we can use the machine?
If the fat, I think that what they mean, if the stubborn fat were thick or huge in size, how can you use the machine to treat it?
Okay, it's a different thing. If we're talking about the hard fat, we could recommend using radio frequency machines for a few sessions before using the cryolipolysis. It will help to liquefy the fat a little bit, and then the result would be better. But if we're talking about the mass or the size, it depends on the machine that we are using, because some machines have big applicator that can fit in the area if it's big or bulgy. I hope that I answered the question in a clear way.
Yes, and we have a following question to you as well, which is, do you use the fat dissolving injections on the same day of the session?
Yes, this is a new protocol I've been using recently. Some studies have suggested that combining the injectable material with a cryotherapy gives a better result. And honestly, I noticed, and that's because some of the fat we are trying to work on with the cryotherapy, especially the middle part, that the coolness wouldn't reach this part. So sometimes as if we're missing some of the cells. So having the injectable material inside will make sure that we're not missing any cells in the treated area. And that gives a little bit better results compared to using cryotherapy alone.
Great. Thank you so much, Dr. Shema. Our next question is for Dr. Farid. What is the applicator you use on the arms?
That's the flat applicator. I think the flat applicator is a very useful applicator for straight areas like arms and like the inner thighs.
And another following question, did you face any skin problems with the treatment?
And arms, you mean?
In general?
No, I actually, in almost all cases, we get a lot of skin retraction, which is really, really nice. Something that you'll never achieve by just doing regular liposuction in certainly some areas like arms or inner thighs. So I think with this technology, you get a lot of skin retraction, which gives even a nicer contouring, and also in the submental areas as well.
Great, doctor. We do have a question for Dr. Shema. How many days between cryo and radiofrequency treatments? I mean, in terms of interval.
It could be from 3 to 7 days, depend on the case. Sometimes patients have a mild inflammation after cryotherapy, so I prefer to wait for a whole week, then starting the radiofrequency session, and then I'll do the radiofrequency intervally each week until we finish the 45 days. In other cases, if the patient is a little bit unhurry, we can start after 3 days if the skin is totally fine, there's no inflammation or edema or anything.
Great, Dr. Shema. We do have the last question of tonight, and it's actually a repeated question, but this time is directed to Dr. Farid. It's about the thick area or firm area like thighs. How would you approach treating that?
I love the Topaz applicator for that kind of area. So anything that is firm, that can be flanks. Some male flanks would have also firm areas. I think the Topaz works very, very well there, and on the saddlebags as well. It works very, very well. You get very nice contouring and very nice results. I've seen, if I may, I've seen one question addressed to me on the list of a colleague asking about using EMS after cryolipolysis, if that would give a better definition and better contouring. And the answer is definitely yes. I think the combination is perfect. Doing first contouring and then tightening of the muscle with, if you can use it with radiofrequency as well, it will tighten the skin even more and will give you a much better contouring and shaping of the, especially the torso and the flanks.
Great. Thank you so much, Doctor, for your addition. Ladies and gentlemen, that brings us to the end of our Q&A session. We hope that today's webinar has provided you with valuable knowledge and practical insights that you can integrate into your practice. Once again, we would like to extend our gratitude to Dr. Farid Kadhim and Dr. Shema Zahir for their time and expertise. We also want to thank DeLeo for their continued support and innovation in the field of aesthetic medicine. Thank you all for your active participation and engagement. We look forward to seeing you again in our next IMDAD webinar. And please note that your CME certificate will take 2 to 3 days to be sent to your email. Have a wonderful day or evening and stay safe.